Hi everyone, this is Dr. Jay Mehta here from Mumbai, and in this video we are going to be giving you a step-by-step guide for the understanding, diagnosis, treatment, management and surgical plans for bowel endometriosis. It is very important for you to understand as a patient, and remember that if you are going to be having bilateral ovarian endometriosis, that means if both the ovaries have formation of chocolate cyst, then in that situation the probability that you are going to also have bowel endometriosis is close to 95%. If only one ovary is having a chocolate cyst, then remember the probability that you will have deep endometriosis is going to be 60%. Bowel endometriosis is one of the subtypes of deep endometriosis for which as a patient you need a lot of attention and care, because your misdiagnosis about this is going to give rise to a lot of problems. Now, whenever I try to draw and explain bowel endometriosis, I would always want to draw the vagina. Above the vagina comes the uterus. When you have the bowel behind the vagina, you as a patient should try and understand and remember that the space which is available between the vagina, the rectum and the uterus is a free space. This is the most important thing. What typically happens in endometriosis is that there is deposition of endometriosis here, and this part is called as pouch of Douglas. Besides the pouch of Douglas, you can have some amount of endometriosis which is present onto the rectum, and in certain occasions this endometriosis is also going to be invading the rectum, that is means going inside the rectum, and as a result of this type of deep endometriosis is very dangerous for the patient. Also remember one thing, how do you diagnose this? Is it going to be simply diagnosed because you are going to have bleeding during menses while passing stools? The answer is no. Is it because you are going to have dyschezia, that is pain while passing stools? The probable answer is no, because majority of the patients still complain of dysmenorrhea, that's painful periods, and because it is located here, this is the place where a lot of patients also complain of something called as deep dyspareunia. These are your presenting symptoms. The best way to diagnose this is to actually put a probe right here in the vagina. This is an ultrasound probe, and do something called as a transvaginal ultrasound for endometriosis mapping. Remember one thing, this thing needs to be done by an expert ultrasonologist. This is going to be much more expensive as compared to your routine evaluation. Let's assume you do not have the expertise which is available for doing this. Then the other secondary option is to do something called as an MRI. But in the MRI, you should remember that we need to put gel contrast here in the vagina, and we need to also put gel contrast here in the rectum. Only when gel contrast is put, then we will be able to diagnose the location of the deep endometriosis, we will be able to diagnose the size, and we will be able to diagnose the depth of invasion. Now this requires a great understanding of the MRI. Only once we understand the MRI, like people like us, we end up reporting MRIs for endometriosis on our own. So when we report and continuously look at these MRIs, we become slightly better. Now let's assume you have diagnosed bowel endometriosis. After the diagnosis of bowel endometriosis comes the actual treatment and the actual plan for treatment. As to how do you treat this, we are going to be discussing in our next video, which is going to be very descriptive as far as the surgical aspect of bowel endometriosis concerned. As a patient, before I conclude, remember one thing: when you have a bowel endometriosis, the only option you have is to get surgery done. There is no medical management which is available for all these deep nodules. I'm going to explain to you how, why in my subsequent video. Thank you so much.